Hello, everyone, and welcome to the last RAP Knowledge Live session of the year of 2023. Thank you so much for joining us for this very interesting presentation on the latest from CycleRAP pilot projects. I'm going to introduce ourselves today. I'm going to be the moderator of the session. My name is Franco Asato. I am the training and accreditation coordinator with IRAP. And our speaker, our presenter today, I have the honor to introduce you to Monica Olislagers. Monica, it's our global innovation and smart cities specialist with IRAP, and she will be presenting the topic of CycleRAP today. Just to do some housekeeping before we start, to be on the same page with you. This webinar, it's going to be about 45, 60 minutes, including the questions and answers space that we like to give at the end of the presentation so that you can actually open your microphones and speak and direct your questions to Monica. But during the presentation, if you have any questions, you can for sure submit it on the chat, and I will be reading those questions and directing those questions to Monica when it's applicable in her presentation. In order to do that, you can see a little hand here in your doc, so you can raise your hand when Monica is finished with the presentation, and I will allocate the microphone usage to you. And what I was saying about asking the questions, you will have a questions box in your panel that you can write your questions, and I will be receiving that. Okay, so being that said, I would like to officially give the floor to Monica. Mons, thank you so much again for joining, and the floor is yours.
Thanks, Franco, and hello, everybody. I'm just going to share my screen so you can see my presentation. And is that showing up okay there, Franco?
Perfect.
Fantastic. Okay, so today I'm going to be presenting to you on CycleRAP. So CycleRAP is a somewhat new risk assessment model that we have introduced here at IRAP. So what I want to do is run through a couple of different parts. So that's me. Thanks, Franco, for the introduction. And this just runs through how I've structured today's session, and so you can anticipate what's coming up as well. So what I wanted to do is just start with a little bit of an intro as to what CycleRAP is, why is it needed, moving on to how does it work later on. So first of all, there's a lot going on in cycling and mobility in our streets. We have lots of trends happening all around the world that is really affecting cities and the way that people are moving around, and lots of different choices. And so just some of the things that we've been observing on bicycle facilities and on streets generally is more cargo bikes. We're having many more deliveries. There's new modes, there's e-bikes and other modes that go faster. There's people traveling at different times of the day as well. And what we find is that, or what we know is that these trends are not geographically specific. I've been living in Asia for the last 7 years. It's certainly been very pronounced there, the shift towards micromobility and bicycling in some countries. I'm now based in Europe, and we're observing a similar trend here. And there's a lot of stuff that's going on that is not directly on the paths that's also influencing this. So after COVID, we've got new working commuting trends affecting many parts of the world. There's a lot of policies directed at sustainability and active travel. We've got a lot of new services through smartphones that we can share mobility, and a lot of the world also is undergoing substantial demographic changes, which means that we have to future-proof our cities for an aging population. Just to give you a little example of what I'm talking about, this is NACDO's data on shared mobility in the US since 2010. And you can see the enormous increase in micromobility. And what this means for cities is that many cities are just struggling to know how to accommodate these road users safely. We know safety is really strongly linked to female participation in cycling as well. Women typically around the world, not in every country, but typically have less vehicle access. So they're less likely to have a driver's license, less likely to own a car, more likely to use public transport. And we know that cycling where it is safe really serves women very well. It's very flexible, and surveys in the UK even show women are more likely to ride even if the weather is bad than men, but safety is a really big issue. And often because women are also traveling with children, there's less tolerance for risk there. So you can see there with the yellow line, all the cities are listed there. So many of them fall below that 50% share for women cycling. And the other big trend that is happening again globally is that cycling fatal and serious injuries are on the rise. You can see there a news story from June this year in the US that cycling fatalities have reached a 46-year high there. The data in the Netherlands, even a very popular country for cycling, you can see I've marked it with the arrows there. Micromobility and bicycle crashes and fatalities are also on the increase. Something we know from the research is that cycling crashes that do not involve a direct conflict with motor vehicles are a really serious problem. So there's studies around, and all the studies are quite consistent in this finding, that 60 to 95% of people who end up in hospital as a result of a cycling crash do not end up there because they were hit by a car. They are there because they've had a crash on their bicycle. Maybe they were avoiding a vehicle, but there's a lot of people, in fact, the great majority of people end up there because they have just come off the bike. And this is also in fatalities. So fewer fatalities, but still 5 to 30%. So the study there was from Paul Skeppers in 2015, I think, and that looked at 12 countries, hospital data from 12 countries. There's certainly similar studies being done in the UK, US, and other places which show the same results. The problem is that often when somebody comes off their bicycle and it's not considered a traffic crash by way that it doesn't involve a motor vehicle, it's very rare that that crash ever makes it into the crash data. So what the problem you end up with is that road authorities or municipalities that are wanting to improve safety on their networks are quite often completely missing any data on these types of crashes. So unless somebody does go to the hospital and does that research and collects that data from inpatients, it's really, really hard to know where those crashes are happening. And so CycleRAP was essentially born out of two things. For those of you who already know IRAP and are familiar with our star rating models, you'll know that the star rating model does have a bicycle star rating in it. But a few years ago, we really perceived there was this additional need. And the need was twofold. One part was that we needed a tool that could be used on cycling facilities that weren't necessarily connected to a road. And the second one was that we really needed a tool that was able to account for these types of crashes that are not being captured in the crash data. So basically, this is what the CycleRAP risk assessment tool does. It looks at these 4 different crash types and then it rates them on a scale of low risk to extreme risk. This is a quick look at our demonstrator tool that's freely accessible on our website. What you can see there is the list of the types of data that we collect for a CycleRAP assessment. And you can also see that for most of them, there's just an option of something is there or something is not there. So it's quite a simple tool. It looks like a big list of things, but once you get into the detail, there's not actually that much data that we collect for these assessments. And as you collect that data on the demonstrator, if you want to try it out yourself after this session, you can see how the change for the different crash types is added up. So what you will see there is that for each crash type, there is a score. The overall CycleRAP score is at the bottom, and what that gets evaluated as is the highest risk one. So for instance, if you have a bicycle lane on a busy road and you've got an extreme risk vehicle bicycle risk, but the others are all green, so they're all low risk, that CycleRAP score will still be categorized as extreme. CycleRAP, I've put together this table just to sort of show where CycleRAP fits best. So at the moment, there's cycling safety audits in terms of best practice are used in some places in the world, but they tend to focus very much on discrete sections of roads or intersections or specific sections of paths. They're a very detailed analysis. And then there are a few methodologies around the world that use things like crash data or simple network-wide analysis in order to understand risk across a network. CycleRAP's sweet spot is sort of in the middle of that, and it can definitely inform more detailed design, but it can also go the other way and inform mass action measures. So if you're doing assessments and you're seeing that there are some common issues across the assessed sections of the network, that can inform a larger work program to address those right across the cycling network in a city. So how does it work? The CycleRAP model is based on a lot of evidence, and all of that evidence is documented in our methodology fact sheet, which is available online. The fact sheet also includes this diagram of the CycleRAP model, but it is very detailed, and there's a lot of bits to it. So what I thought I would do quite quickly is just run you through a bit of a visual explanation of how the model actually works. So the model starts by looking at things that initiate a crash. So we're looking at things like crash triggers. What needs to be on a facility for a crash to essentially be initiated? Doesn't necessarily mean it'll result in one, but what can start that? There are 4 in the model that we use. The first is an avoidance maneuver. And for this one, we assume that there will always be something to avoid on the path, because whether we're assessing a street or a sidewalk or a bicycle path or a bicycle lane, we assume that there'll always be another cyclist or another person on there. So depending on what sort of facility it is, if it's a shared path, you might be seeing pedestrians on there. If it's a multi-use facility in terms of like something like here in the Netherlands where they have a Fietsstraat, you might be having vehicles using that facility as well, or it might just be a local street. But there may also be other objects to avoid, things like fixed obstacles or things like garbage bins that can be moved. The loss of control, we've got 2 of them. One is due to speed, one is due to function. And yeah, I guess the easiest way to understand this is the loss of control due to speed. Imagine going down a hill and having a corner, and particularly if there's something on the surface like ice or slippery gravel, that could quite easily end up as a crash. The loss of control due to function is where your wheel of the bike or the scooter or whatever it is you're riding has a risk of getting stuck. So we have common crashes around tram rails for this reason. Drain openings are a real problem. Potholes are also a big problem. The 4th type of crash trigger is just getting hit by a vehicle. So after we take into account what triggers are present, we then look at things like contributing factors. So we're going to be looking at everything on the path that could increase or decrease the chance of a crash. The first big one is the number of things to avoid. If you've got 1 or 2 people on a path to avoid, that's much easier than trying to avoid a whole bunch of people plus a bunch of obstacles. We've got things like surface issues. If you're trying to avoid someone and you're hitting a really slippery surface, that's obviously going to increase the risk of a crash. Narrow paths give a lot less room to maneuver around, and if you are trying to avoid someone or something, it's going to be much more likely that you'll end up exiting the path. It could be a road crossing or an intersection as well that increases the chance of a crash. But there are also things that decrease the chance of crashes. So good lighting, wider paths, good delineation, and so forth. So after we know what the triggers are and what the contributing factors are, we then look at what could possibly happen as a result of that. And there's a number of different outcomes. One is that you try to avoid and you're successful and you get through and nobody gets hurt. Second possible outcome is that you either hit the thing you're trying to miss or hit something else as a result. That could be a cyclist coming the other way. In some cases, if there are vehicles using the path, you could get hit by a vehicle. That's the vehicle impact. You may try to avoid but run into something else like a slippery surface and fall as a result. Or you might leave the path. And when you leave the path, this is where things can get interesting because there might be all sorts of things next to that facility. And so you can imagine for a bicycle lane, this really might be something that is jammed up against the side of the road. For something like a sidewalk, you could have different things going on beside the road as well, including trees. In this diagram, we show there's a footpath on one side. So if you leave the path, there's a risk you could hit pedestrians. If you have a waterway next to a bike lane or a bike path, that you could end up in that. Or you can end up on a road. So a very common configuration is with bicycle paths directly next to traffic. And what we then look at are things like the severity factors in the model. So one of the severity factors, for instance, is the speed of vehicles, because if you have vehicles on that road going 30 kilometers an hour or less, that's not going to be as high a risk as, say, vehicles going at 50 kilometers an hour or 80 kilometers an hour. So here's a little example. This photo is taken from my hometown in Brisbane. And what I did was I took a photo while we were doing this inspection. And just to quickly demonstrate some of the key features that we look at in the CycleRAP model. So this is a two-way facility that goes through a very busy part of town, right near a hospital. So there's a lot of pedestrians crossing this road. It's actually the result of a road diet project. So previously this road had more lanes with higher traffic speeds, which have since been reduced, and some of that space, road space, has been repurposed for this bicycle facility. And overall, it looks quite good. This is an off-peak time, and when we were doing the inspection, there's a good surface. There's no gravel on it. There's a bit of light segregation there with between the bicycle facility and the road lane. The mean speed is quite low. There's good lighting. But there are a couple of issues here. One is that, as I mentioned before, there's a lot of pedestrians because there's a hospital. There is a signalized crossing though, which is good, and it's visible. The facility is two-way. One of the issues here is that this is actually on I'm not sure I included it here, but it's on a slight hill. And because it is in the center of the city, this path gets very, very crowded. There is a side hazard as well, that the curb, if somebody needs to miss somebody else, that curb is too steep and will actually result in them falling from the bike. The wheel will not be able to mount that curb. Yeah, as I said, narrow lane widths, But if something does go wrong on the other side, there's a very good chance that a cyclist could end up on the road lane itself because it is so close to the bicycle facility. And as I mentioned, very busy during peak hours. There's a second part of the model, and this part has only recently been introduced, and so we now have the safety treatment model guide available on our website. And what the safety treatment model does is once the risk is identified on the network, it then searches the results for combinations of features. And when these combinations of features appear, it recommends safety treatment, and then these safety treatments are prioritized by risk score. And what this really enables cities to be able to do is say, okay, I can observe all these things across my network, but by understanding which ones need to be addressed first, they can prioritize the treatments of those. And so we have a total of 25 possible recommendations, and they're split up into 4 categories. So it will either be recommending modification of the facility type, might be recommending improvements. There are 11 of those. For intersections, there's safer designs recommendations, and also more cyclist-friendly roads. Okay, before I move on, Franco, are there any questions?
We only had one question at the beginning of your presentation, Mons, about how to consider the mobility of e-scooters.
Yeah.
In terms of, do we consider them as equal to a bicycle? Are there any different considerations due to the experience that you have in the field?
Yeah, it's a really good question. When I was reviewing all the literature, and in fact, only last week I was at the International Cycling Safety Conference in The Hague, and the evidence says, and the research says, even that presented last week, was there is actually no difference in the crash types and the frequency of particular crashes. And so this model can be used to evaluate the safety of facilities for e-scooters just as much as it can evaluate it for bicycles. So it can be used freely for both.
Perfect. Thank you so much, Mons, for the answer.
That's
We don't
okay.
have any other questions for the moment.
Yeah, and so the model does take into account different vehicle types as well. One of the key risks that is documented very well in the literature is when you have a mixed fleet of different types of micromobility. So you might be having mopeds using the same facility as bicycles, as cargo bikes. So these different bikes that are capable of different speeds and have different weights do create high risk on a path. And what often happens is that you get a lot more overtaking behavior where you have different types of bikes, particularly electrified bikes as well, or motorized bikes. Okay, moving on to part 3. So CycleRAP has now been used on approximately 1,000 kilometers worldwide in 10 different countries. After we launched actually it was before we officially launched CycleRAP at the VeloCity conference in Ljubljana in Slovenia last year, we had used it for the Sabrina project in the Danube region in Europe. And you can see a list there of locations. Some of those locations, for instance, in Vienna and Croatia, it was over approximately 250 kilometers of assessments each. And then there were some smaller scale assessments in Bulgaria, Slovenia, Slovakia as part of that project. And that really helped us refine the methodology. The assessed facilities were all Eurovelo routes in that region. And then at the beginning of this year, we kicked off with the international pilot that we've just completed. So this report was launched at the UCI Bike City Forum at the end of last month. And this report is available on our website. I'd encourage you to have a look afterwards. But what I'll do is I'll give you a quick a quick summary now. So the 5 cities we did assessments in was Fayetteville in the US, Barcelona and Madrid in Spain, Bogota in Colombia, and Sao Paulo. And the really interesting thing about these cities is that each of them had to start the process in identifying what network they were assessing and why. And this really changed depending on where the city was at. Maybe the city had a cycling strategy it was putting in, maybe it had identified issues. And so there were lots of different ways the model was applied through these cities. And that's what's a really nice outcome of this project, is that all of these different use cases are presented in that report. Bogota assessed 50 kilometers of their network. They were looking at primary cycling corridors with different types of infrastructure. And so you can see there the map of the corridors assessed, and the municipality staff did the assessments themselves. They attached the cameras to the handlebars, rode around the city and captured that data. Sao Paulo was a very interesting one. There is a local NGO there that had collected a lot of data about cycling cycling facility conditions, and we were then able to extract over 1,000 of those locations across the city and assess the safety of those sections of infrastructure. In Fayetteville in the US, so Fayetteville is an ambitious cycling city and is really putting a lot of investment into their cycling network. And they use the model to be able to understand the risk across different kinds of different types of infrastructure, if you like, but also to understand what needed to be done for corridors that they were looking to upgrade, but they were using the CycleRAP results to inform those upgrades and those designs. Madrid and Barcelona, both of them were looking at different types of facilities as well across the cities, and also how to expand their cycling networks in line with their sustainable mobility plans as well. And then from all of the experiences in the cities, we assembled these different case studies, which are a part of this report, but can be downloaded individually as well. And what they look to do is help other cities understand how to do a CycleRAP assessment, where to start, how to do things like collecting data, mapping risk, how to simulate safety treatments, and also some other learnings. So the project outcomes, really what we were looking to do is not just support cities with examples of how to use this tool and how to shape it to their purposes, but also the lessons learned from the pilots. And here's some nice examples of what safe cycling infrastructure looks like across each of the cities. And we found some really nice examples of where off-road paths had been designed very, very well, managing conflict with pedestrians where you've got those flows happening across, and the sort of treatments for this one, for example, this one in Barcelona, which has got really good visibility and clear signage. Also some great examples of multi-use paths out of Barcelona. In Fayetteville, we saw some great examples of where they did manage hazards around the cycling facilities. So often where there's waterways or bridges, that the side barriers and so forth were done in such a way that there was no risk posed to cyclists. And then also examples of cycling friendly streets. And I think the important thing, even with this example on the right from Sao Paulo, the important thing is not necessarily how beautiful a cycle path looks, but it's about the objective safety of it. Is this facility safe. And this is what the CycleRAP model really does, is it drills down into the things. It's looking at the condition of the surface, what the barriers are, if there's, in this case, light segregation, what the speed of the traffic is, and so forth. So I thought I'd spend the next little bit just running through how to do a CycleRAP assessment. So there's several steps, and for anyone familiar with the IRAP star rating process, this one's a little bit similar. There are basically 6 steps, and the ones that you can see there with the little yellow ring, they are ones where our CycleRAP suppliers or IRAP can support a city in doing these, working through these steps. So the first one is network identification, and this is a really important one because this is basically selecting what to assess and why. And there's lots of different ways that assessments can be designed or networks can be identified depending on what the priorities are. So there's just a couple of examples we've highlighted here, and there's more on this in the CycleRAP user guide that you can read up on as well. This one, for instance, is a focus on commuter corridors or how to improve general cycling safety across the network. So you can see a few green corridors there that have been identified where there's gaps or disconnection in the cycling network. This second map shows perimeters around schools. So it's up to a 1 kilometer radius of if you want to be improving safety of school students accessing schools. This is also a great way to select which network to assess. And this one here is demonstrating how you can improve cycling access to transit. So essentially, if you have a tram route or a train route, well, you can also then be highlighting access to stations and essentially increasing ridership on that transit network by making it easier and safer for people to ride to and from stations. So the second task, this is one that cities, as I mentioned before, Bogota had done themselves. Sao Paulo had also collected the visual imagery themselves. So this is one that can either be done by a CycleRAP supplier, IRAP, or a municipality themselves. It's quite a simple process. On the right there, you can see the team at FPZ. So FPZ is one of the CycleRAP suppliers doing the assessments with a instrumented bicycle in the Danube region. So it's just a matter of, for them, they attached a camera to a pole behind to get the height, which means you can get good visuals of the path. Cameras can also be attached to handlebars. We don't recommend that cameras are ever attached to bicycle helmets, and the reason is that bicyclists, as they're riding along, need to be able to look around them a lot, and it really disrupts the visual imagery if the cyclist is looking around or behind them. Generally, what we recommend, and this will differ depending on who is collecting the data and so forth, but we recommend that for an assessment by bicycle, that there's about a maximum of 20 kilometers per day per person. So if you have 2 assessors out on bicycles, you can cover about 40 kilometers a day. Otherwise, it's really both for just the distance that needs to be cycled, but also the quality of the imagery and being able to check things. It's highly recommended that quality assurance process is done well, and that you're not trying to do too many kilometers every day. With the GoPro cameras, so they have a GPS inbuilt in them, so it makes that very easy to geolocate the imagery, but things do need to be considered, like battery packs and also linking it up with a smartphone or something can also, on the handlebars, can also then help the rider understand, is the imagery good, is there enough light, and so forth, which also prevents you from having to go out and do it again if it doesn't turn up, if the quality of the image isn't good enough. This is, I'm not sure if you can see, but this is a small video of the assessment that was done. This is from the Danube region, so this was taken by FPZ, but you can just see there the clarity and quality of the image as Marco is riding along that facility. CycleRAP assessments can also be done on a spot-based approach, so it doesn't need to be video. You can also just take images like they did in Sao Paulo and assess those, and we call that a spot location as opposed to a length-based assessment. Length-based assessments generally work at every 10 meters, but can be expanded up to 20 meters or customized as needed. So the second step is actually the coding process. I'm not sure how to turn the sound off on this one, but I don't think it's too noisy. But this is, once this video goes into a coding interface, so this is FPZ's coding interface here, you can see the coding buttons change. So while it looks like there's a lot of data being collected, there's not actually too much changing as you're going along the path. The next step in the process is to calculate the risk scores and map the results. One really important thing to pay attention to in the CycleRAP assessments is that it's very sensitive to speeds. What we use is the mean speed, and the more granular that data is, the better the results. So if you can really get mean speeds, for instance, through intersections and for mid-block sections, that's going to give you much more high quality results. And part of this is because we didn't want to have to collect a lot of data around the road design to be able to evaluate the risk of vehicle impacts. And for instance, if you have an intersection that is well designed or that has traffic calming, and as a result you see a reduction in the operating speed in that intersection, that will be captured by that operating speed. Whereas if you're not taking that mean speed at that granular level, it's very hard to see what else is going on that might actually be making that intersection safer than most. So that's why the speeds are so important in the model, and also inform the different kinds of facilities, as you can see on the chart here. So here is an example from Vienna with the CycleRAP results mapped, and then you can pull them up on sort of what we call a risk worm, and then do that analysis. You can understand what the different risks are for different sections. You can start pinpointing where you might be getting very high points in the vehicle bicycle crash, for instance. So the top chart there, BP stands for bicycle pedestrian risk, and VB is vehicle bicycle risk. So then the fifth step is to generate the safety treatment. So as I mentioned before, there's 4 categories of safety treatments, and these can be these are essentially recommendations and guidance. It's not something that is prescriptive. And what at the beginning of the presentation, I showed that triangle diagram, which said this is what's detailed and this is what's sort of more general. Well, the idea here is that you can understand what the top 3 to 5 things that need to be done to improve safety, and then take that away to your design team to really discuss what's suitable and what's not. So the idea is that the treatments to the risk are identified, and then, pardon me, the CycleRAP recommendations can help you identify those locations where the risk is highest and what will be most effective. And then the idea is that you consult with others on what the best solution to the risk is. So CycleRAP can also be used for evaluating and improving designs. So here you can see an example of a PTV simulation. So this is a very sophisticated one, but of course, paper-based designs are perfectly okay as well. What we generally do is recommend that baseline assessments are also done, so you've got that basis for comparison to what exists now and what's being designed. And that also helps fill in some of the other data that may not be apparent in a design, particularly a paper-based one. It's easier to tell from these simulations what other factors are going on around. But if you don't do a baseline one, you can also use like a CAD software to establish the center lines and the segmentation. Okay, so I think that just about wraps it up. For more information, so where to next, and if you're more interested in CycleRAP, and sorry, I should say you're interested in more about CycleRAP, then please do have a look at our website, cyclerap.net. On that page, there's quite a lot of information there now. It's been really building up over the last couple of months now that we've finished these international pilots, and the case studies are there. But you can find all of our technical documents there. You can find our list of suppliers and also our contact details, so you can reach out to us, all the suppliers, if you're interested in looking at CycleRAP further. So thank you. That's everything, Franco. Thanks.
Thank you. First of all, thank you so much, Monica, for your presentation. Now it's time to to do some questions. Let's say you can raise your hand. We would really like to having you asking the questions rather than me reading those. But while someone breaks the ice, sorry, I passed the slide too soon. In order to break the ice, I'm going to read a couple of questions. Monica, you mentioned already that you can use the CycleRAP tool to assess a design. So that was one of the questions. I'm not going to direct that, but the question was related to the usage of the CycleRAP tool for low and middle income countries. You know, in low and middle income countries, the facilities are still like in development. Like the usage of bicycle is still being encouraged, let's say. So is it clear that CycleRAP is valid tool for low and middle income countries as well?
Yes, absolutely. And I'm only beginning to appreciate how much, but yeah, as a practical example, I've been living in Asia for the last 7 years. There is a lot going on there in terms of cycling strategies. I've also had similar conversations with countries in Africa also working on cycling strategies, I should say cities, because a lot of the cycling strategies are happening at the city level. And CycleRAP can really help cities understand what facilities are working well for them risk-wise, what facilities are not. So particularly in this stage where some of these cycling networks are in the early stages of development, that is the most crucial time to get safety right, because you're going to save a lot of time and a lot of money if you design safe infrastructure at the beginning, rather than putting facilities in and finding one that people think they're too risky and are not using them, or that are resulting in a lot of fatal and serious injuries. And so, yeah, absolutely important. We had a master's student look at Addis Ababa for this particular in this particular use case, and so What he was doing was looking at some of the early infrastructure that Addis had been installing, and also looking at the cycling strategy about what their expansion plans were, and then using CycleRAP to inform some of the recommendations going forward.
Thank you so much for your answer, Monica. So we are clear on that, and that's a great approach and a great tool to use also in low and middle income countries. We have a hand raised by Kyle. You should be able to unmute yourself now, Kyle.
Hi, yeah, I was just wondering, the the classification or part of the classification part of the evaluation was what I was kind of interested in. Is that a tool that you have to kind of contract with IRAP, or is that something that is available, or are there other methods that you recommend? Because I noticed it seemed you said 10 to 20 meters between evaluation.
I think we're losing Kyle. Sorry.
Uh-oh, can you hear me at all?
Yep, I can hear you now.
Okay, yeah, sorry, I've got a bad connection here. I was just wondering if there are open tools to conduct the evaluation, or is that something that you do when you you contract between your city and IRAP to do that?
Yeah, it depends a little bit. So we have the model, and there's a free to air, like an open tool available on our website, which is the demonstrator. But it is a demonstrator. It's not nearly as fast or efficient enough to do a length-based assessment of there. By all means, you could do CycleRAP assessments of a series of images using that tool without any problem. That tool, though, doesn't give you the safety treatments as well. IRAP's established as a charity, so we are really, our first call is to save as many lives as possible through supporting cities to create safer mobility networks. That's a big priority of ours. So we certainly are open to working with cities to minimize costs. We, from our experiences, we know that the use of the tool costs around $200 US per kilometer. And that's sort of beginning to end in terms of data collection and all the data processing and the mapping and reporting and analysis and those sorts of things. And that's based on roughly 50 kilometers of assessment. Some costs vary according to kilometers, other costs are just flat costs. So it's just ballpark figures. But we also, because what we have is a model, and we're not necessarily, well, we haven't yet built the interface tools ourselves. So that will happen, that software development will happen at some point. But at the moment, we do have a network of suppliers that have invested in those tools and are using that, and also are working on things like automatic detection of the data. So their solutions can be very nice, and they're often tailored to the clients that are around them as well. And this was one of the early findings we had with CycleRAP. Cities had very different needs, and so what we wanted was a network of suppliers that could tailor software to those needs, not just have a one-size-fits-all for the whole world. I hope that answers the question.
Thank you so much, Monica, for the answer, and Kyle for the question. And I think there's room for an answer on my side too, as training, right? And we are for the future really working into having some kind of basic training as we have for other tools. As Monica says, not to do something big, but for people to have the basics and then create something big at a local stage. And we have great partners that are doing great projects with CycleRAP already. So also speaking with them will be a nice approach. I only have one question left that I haven't directed to you, Mons. I'm going to read it out. It says, do we know what is the bicycle speed limit on bicycle path or on bicycle lane? And does that affect the rating score? I assume that it's talking about the speed of the bike in the bicycle lane, if it's common to have speed limits or not.
It's not common to have speed limits. And in fact, the CycleRAP model, it works off operating speeds. So it does allow you to collect the speed limit of a road, because that kind of gives you an indication of, are my operating speeds of the traffic higher than the speed limit? But in terms of bicycle speed limits, it's not a factor that we consider. I'm just having a quick look now on, because what we do collect in the model is hang on, give me a sec. It's the average speed of bicycles and or light mobility, so that could mean scooters as well. So that's going to be, the average speed is going to be less than 20 kilometers or greater than 20 kilometers. So where you might have an issue like a downhill area where everybody is picking up speed, or you have a very high proportion of electric vehicles, then you're going to see that average bicycle speed or light mobility speed go over the 20 kilometer an hour mark. The other input that we do consider in risk is the difference in the speed. So if you're seeing an average difference of 10 kilometers an hour or more between your different bicyclists or e-scooters or whoever they are, that's another risk, because we also know that bicycles traveling at different speeds, or you might have mopeds and bicycles mixed, where you'd be expecting to see that difference as well. And the other one is also hills, because generally when someone's cycling up a hill, they're going very slowly, whereas a downhill, they're going faster. And so you get, again, that speed differential on those two-way facilities.
Thank you so much, Monica, for your answer. We don't have any other questions for the moment. So I am going to start the closing remarks of the meeting. But if there is any last minute hand raised, I can allocate the word for sure. Just to let you know, well, this, as I said when I opened, this was the last session of this year of RAP Knowledge Live. But for 2024, we will for sure have other sessions. You will find the next session available in irap.org /training in schedule live webinars. And more information about what we have been discussing in this meeting with Mons and on the last meetings can be found in these links. You can always send me an email if there were any questions that you would like to direct to Monica, and I will be able to send those to her, or and bring you a response that exceeds this meeting. And just to give you a hint of your regional contacts, the people that you may want to contact depending on where you are located. You have Greg Smith, the Global Program Director, and the Asia Pacific Regional Contact. If you are located in Europe, you will want to get in touch with Samar Aburad, our Safer Journeys specialist for Europe, as I was mentioning. For Africa, we have Natalie Chivaza. I hope I pronounced that correctly. Our Safer Journeys leader for Africa. And if you are located in South America or Latin America and the Caribbean, you may want to get in touch with Edgar Zamora, who is our Safer Journeys lead for the Americas region, as I was saying. So yeah, before closing, this is my email I was mentioning. If you need to get in touch, if you have any further questions, please don't hesitate to write, and I will direct the questions accordingly. And I want to really thank you for your participation, and Monica for your time for this presentation. And I hope to see you back on the first session of 2024. See you all, and thank you so much.
Thanks, Franco. Bye, everyone.
Bye bye.